How to bring down glucose truly overnight. Distinguishing evening plunges and glucose can be dubious, yet these basic techniques can assist you with forestalling evening hypoglycemia and rest without stress. Rest sufficiently, realizing your glucose will remain consistent at night. Thinkstock. Evening time dunks and glucose levels are normal among individuals with diabetes. Creators of an investigation distributed in June 2013 and Quality of Life research noticed that individuals with diabetes type 1 or type 2 experience low glucose or hypoglycemia during rest more every now and again than numerous specialists figure it out. Evening time hypoglycemia can be brought about by various components, from practicing excessively near sleep time to savoring liquor the night. In the event that untreated, low for the time being glucose level can prompt cerebral pains and loss of rest, and in outrageous cases, seizures or even demise. Fortunately, forestalling low glucose while you rest can be accomplished with a couple of straightforward advances. First, check your blood sugar before bed. For everyone with type 1 or type 2 diabetes, it's completely important that they check their glucose before heading to sleep to ensure they're not going to have a scene of low glucose during the night, says Helena W. Radward, MD, Clinical Chief of Endocrine and Metabolic Consultants, a private practice in Rockville, Maryland, and past leader of the American College of Endocrinology. On the off chance that your glucose level are low at sleep time, eat a solid nibble before resting. The size of the bite ought to be with respect to the plunge and glucose. For example, a little drop in glucose requires just a little bite. In the event that you utilize an insulin siphon, think about incidentally diminishing the dynamic portion of insulin. Second, know the signs of low overnight blood sugar. Side effects of hypoglycemia ordinarily create when glucose levels dip under 70 mg for every deciliter. They incorporate flimsiness, perspiring, disarray, unpredictable conduct, cerebral pain, and dizziness. With evening hypoglycemia, you may wake up with these side effects or with a higher glucose arousing that outcomes from the body's reaction to a short-term low. In any case, a few people experience what's alluded to as hypoglycemia ignorance, which implies that they don't feel the indications of low glucose. Talk with your physician about approaches to perceive evening time hypoglycemia, particularly on the off chance that you figure you may experience issues identifying it. It's a perilous condition since individuals can tell when the glucose has dropped since they might not have indications by Dr. Radbard. The body can get desensitized to it. People with hypoglycemia ignorance are likewise more averse to wake up because of evening dunks and the glucose. Third, try not to skip dinner. Skipping supper or having just a light dinner is one of the most widely recognized reasons for evening time dunks and glucose by Dr. Radbard. Eat a sound, even supper, consistently and focus on divide sizes. Keep away from excessive exercise late at night. Normal exercise is suggested, yet arduous exercise directly before sleep time is on the grounds that it can cause blood glucose to drop for the time being. This implies you ought to abstain from practicing in the 2 hours before sleep time. On the off chance that your glucose level is under 100 mg deciliter at sleep time after exercise, to fold your customary sleep time by to forestall an undesirable plunge while you rest. Fifth breaking point, alcohol at night. Liquor utilization can likewise build the hazard for evening time hypoglycemia, so maintain a strategic distance from customary utilization of liquor. On exceptional events, drink just with some restraint, close to one beverage daily for ladies and two beverages every day for men, and don't hold back to enjoy with a preceding bed nightcap. On the off chance that you do have a beverage at night, getting a charge out of it with food can limit the opportunity of low glucose while you rest. 6. Be prepared. On the off chance that you as often as possible wake up with side effects of low glucose, have something accessible at your bedside, for example, a pop or some juice, so you can respond quickly without getting up to treat it. On the off chance that low glucose around evening time is a typical issue for you, converse with your physician about changing your diabetes treatment and tend to more readily control your evening time glucose levels. If you like this video, please hit that like button. Also, if you would want to see any videos in particular, please comment below. I have many similar videos being released in time. So please hit subscribe and notifications.